Morning or good afternoon, depends on where you are. Thank you for joining the Water Talk. This is the last one for 2026. And today I'm extremely excited to introduce Dr. Nisha Chardkoudian from USARIM, the U.S. Army Research Institute of Environmental Medicine from Natick, Massachusetts. So Dr. Charkoudian is the Chief Thermal and Mountain Medicine Division. And her research interests include the influence of heat, high altitude and hydration on sympathetic neural responses, cardiovascular regulation, and exercise performance. So Nisha, thank you for visiting us, and we look forward to your talk.
Great. Thank you so much, Stavros, and thank you all for being here in person and online. Title of my talk today is Autonomic Control of Body Temperature and Blood Pressure, basically my two favorite topics, during heat exposure in women and men. I have my conflict of interest statement. I don't have any relevant financial relationship or conflict of interest. Importantly, today, the views represented are my own. I am here as a private citizen and not as a representative of the U.S. government. The government is shut down currently, so I am here on my vacation time, private citizen representing myself. So I thought I'd start out, I really like this graph that has to do with work time lost during extremes of heat and cold. And I thought I'd start out with this because a lot of times in our work life or as we're putting together, research proposals or thinking about research we might want to do, a lot of times we're asked, well, why should we care? So why should athletes or the military or industry care about exposure to temperature extremes? Or if we talk about climate change or but besides things like illness, why should people care? And one of the reasons that we care is that, I have to get this, sorry. Let's see if I can figure this out. Yeah, so one of the reasons that we care is that if you go too far away from this ideal temperature of which is right around 20 degrees C or 68 degrees Fahrenheit, you can see that you increase the amount of total work time lost, whether it gets colder or warmer. And this is just in plain ambient temperature. So how do we, if we're interested in optimizing exercise performance or work performance, how do we do that if we don't always have the option of being right there in the middle? And this is work from Ioannou and colleagues that was published earlier this year. The other thing I want to introduce is this concept of sex as a biological variable. In general, if we look across kind of the sports medicine literature, there's been a trend for increasing participation of women in sport and outdoor activities, as well as increased recognition of the importance of including women in research studies. Delightful, because we definitely needed to do that, and we still do. But one thing I like to point out when I'm giving talks like this is that the inclusion of sex as a biological variable is not the same as the study of sex differences per se. Sometimes I have someone come and talk to me and they say, well, I can't study women because I don't have enough, I can't double my sample size and I don't have enough money to study, 15 extra people. But that's not the same thing. So when we say we want to be inclusive and include women in research studies, that is not the same thing as powering every single study to study sex differences. When we think about military and occupational applications, it's often as important or more important to identify areas in which there are no sex differences as areas in which there are. And I'll come back to that later with some stuff that we've done recently. For example, assumptions about women being more fragile or less tolerant to the heat have historically led to women's exclusion from athletic events and some military occupational specialties that actually really have to do with career advancement opportunities and really physiologically have nothing to do with safety. So if we think about, I think I'm echoing there. No? Okay. If we think about sex as a biological variable in human physiology specifically, again, when we're thinking about the folks who are going to maybe fund our studies or people who are asking us about the relevance of our work, we might get questions about something being better or worse. So for example, are women better at regulating blood pressure? Well, we know that prior to menopause, women tend to have, not always, tend to have lower blood pressure than men and tend to have less risk of hypertension compared to men before they reach menopause. But is this better, or does this just put women at greater risk for hypotensive disorders such as orthostatic hypotension, postural tachycardia syndrome, and other autonomic disorders. So I guess what I'm saying is it's sometimes an oversimplification when people say, is this better or is that better? Are women worse at controlling body temperature? Well, sometimes, but not always, women are shown to have lower sweating rates. But as far as we can tell, this does not put women at increased risk of heat illness and may be more efficient in terms of hydration and water loss. So it's very important not to oversimplify because it often depends on the specific context, whether a specific tendency is better or worse. And really importantly, there's so much inter-individual variability. So for people who are interested in almost any exercise physiology related variable, you always see so much variability. Sweating rate is a big one, right? There's people who are heavy sweaters that are women, people who are lighter sweaters that are men, and all over the map. So it's important to keep all those things in mind. So I'll just take a step back and just talk a little bit about the basic physiology of thermoregulation for those of you who don't think about it all the time like I do. And the thing that's always been very striking to me is that humans are exposed to a wide range of thermal stimuli, both internal, such as exercise, and external, such as the environment. And at the same time, we are really remarkably capable of maintaining our core body temperature within a few tenths of a degree of 37 degrees, despite a huge range of thermal perturbations. And we accomplish this by a combination of heat dissipation responses that occur during increases in body temperature and heat conservation or heat generation during cold exposure. So my focus today will be primarily on heat dissipation responses relevant to exercise in the heat. So if we think about body temperature increasing in humans, the major methods of heat dissipation are cutaneous vasodilation and sweating. So dilating the blood vessels in the skin increases the amount of blood flow to the skin for convective heat transfer from the core to the periphery. And sweating, and more specifically evaporation of sweat, cools the skin and works with skin blood flow to cool the body. When sweat can't evaporate, it's harder to maintain body temperature. This is why humid environments are so much less comfortable for humans than dry environments in general. So this is just I won't go into a lot of detail on this slide, but it's just kind of a summary slide of the integrative control of body temperature during heat exposure. And you can see that on the left-hand side there, we have the preoptic area of the anterior hypothalamus and also some areas in the spine, which act as integrators for afferent information concerning body temperature, which comes from, as you can see, both peripheral and central thermal sensors. I've talked a little bit about cutaneous vasodilation and sweating. So when heat stress occurs, that information is sent to the hypothalamus, and then which then results in reflex activation of thermoreceptors such as dilation and sweating. And the one that I didn't talk about yet is behavior, and I won't talk as much about that today. But But the importance of behavior is that is what allows us to make choices regarding what we do, such as put on a sweater if we're cold or take off a layer if we're hot. And this is often important when we're working with the military or other groups to try to optimize that behavior component. When we think about the influences of female reproductive hormones, we can see this is a summary slide that kind of a different way of looking at the preoptic anterior hypothalamus and then the skin blood flow and sweating responses. By the way, I drew that sweat gland 10 years ago on PowerPoint, and it doesn't look anything like a sweat gland, but now we have biorender and all that other stuff. So the thing I wanted to talk about here is that we have sympathetic neurogenic heat dissipation mechanisms, and then we have influences of estrogens and progestins, which I won't go into in a lot of detail, except to say that estrogens tend to augment sweating and vasodilator responses. And you could look at this and say, okay, maybe influences of estrogen in human estradiol may be some kind of like augmentation or advantageous response for heat dissipation. So if we look in a mouse model, there's my colleague Orlando Laetano and Tom Clanton in Florida did a lot of work over the past several years regarding treadmill running in the heat. They worked with my colleague Lisa Leon at Ethereum, who's developed this exertional heat stroke model. And what you can see here in the upper right is is that they have this model where mice run on a treadmill in the heat until they reach a maximum core temperature, and then at some point they collapse, and then they can't go any further. So that's considered the exertional heat stroke model in mice. And what happened in the mice that they were studying, male and female mice, is that the female mice in this study, which was published in 2018, were able to run longer and basically able to dissipate heat more effectively and had a greater total distance run, and this thing called ascending thermal area, which is the area under the curve until the temperature reaches that maximum point. So they used C57 black 6 mice, and they ran 40% longer in the heat compared to males and had a greater total distance run. So in Orlando's lab, they wanted to follow up on this by looking at ovarectomy and seeing if that had an influence in these female mice. So you can see the sham and overectomized mice, and it turned out that it did, in fact, both in terms of running time and in terms of HSP72 expression. So overectomy in female mice resulted in a 30% decrease in time to collapse. So it kind of reversed that, that advantage that the female mice seem to have, suggesting that ovaries or estradiol contribute to these sex differences that they showed. So what about humans, right? Mice are not always small humans. So what about the human data? So this slide and the next one is not from our lab, but I thought it was really interesting. This is a study published by Sean Notley and colleagues in 2022, looking at these particular data are from minute 75 of 180 minutes of treadmill walking. So continuous steady state work in the heat, about 200 watts per meter squared. And you can see it's divided into men and women. And if you look at the individual data or the difference from men, you can see that there really wasn't any difference from men in terms of this activity. Bless you. But you can, then they also measured heart rate, which is great. And you can see that the heart rate in women was higher than average heart rate in men over the course of that, which would make sense if the relative workload was a little bit higher for the women compared to the men. But interestingly, their core temperature was not different. So what about intermittent work in the heat? If we think about military applications or applications that have to do with a lot of like work scenarios, it's often intermittent, right? We are sometimes, usually out there working in the heat, we're not necessarily doing like steady state treadmill exercise for 180 minutes. So this is intermittent work in the heat, published by Anderson et al. Also in 2022. And you can see down here that they, again, had the same absolute workload. And it was different intermittent workloads, and there was rest in between. So you can see the R's on the bottom, which show when they were resting. And you can see rectal temperature on the top panel and heart rate on the bottom panel. And you can see that there was similar or lower, in this case with the intermittent exercise, there was similar or lower rectal temperature and heart rate in women compared to men. This is an older study from Dan Gagnon and Glenn Kenny, looking at different intensities of exercise in the heat and something called E required, which is the requirement for evaporation, so the requirement for evaporative sweat loss. And it basically means that combination of the intensity of the workload plus the environment. And you can see on the left there that there's different intensities basically along the x-axis here. And at the very highest intensity, you can see a higher sweating rate in the men compared to the women. There was, and then on the bottom panel, I think is skin blood flow. Yeah. And there was no difference in skin blood flow. So the sweating rate on the chest, 3 absolute levels of exercise plus heat stress. There was at the very highest level of heat stress, there was significantly greater. Oh, I wrote that wrong. There's a greater chest sweating rate in men. Apologies. And then skin blood flow was not different. So what about heat acclimation? Heat acclimation or heat acclimatization refers to the physiological adaptations to repeated heat exposure. Usually when you see heat acclimation studies, they're usually about 8 to 14 days or more. The term, in case anyone's wondering, the term acclimation refers to a laboratory environment, whereas the term acclimatization refers to an outdoor environment. So often when you see like altitude acclimatization, you'll see the word acclimatization because it's really very difficult to keep someone in an altitude chamber for 2 weeks. But in terms of heat acclimation, it really is the gold standard for optimizing performance and health in the heat. This is the best way we have as humans to decrease physiological strain, decrease risk of illness, and really optimize exercise performance. The physiological adaptations during, as I said, usually 8 to 14 days of heat acclimation include increased sweating rate, decreased core temperature, decreased heart rate, and sometimes, but not always, increased plasma volume. So when I say decreased core temperature, that is often decreased core temperature across the board, but most importantly, it's decreased core temperature during exercise. So that if you can get to a point where your core temperature isn't increasing as much for a given exercise intensity, whatever you're doing, that's always going to be kind of represent more optimized regulation. So performance often increases and perceived exertion decreases for a given task in the heat. So along with some of these other debates in the literature about what women can and can't do, that, as in case you can't tell, drive me crazy. There's been some debate in the literature over the past 20-ish years as to whether women are able to adapt to the same extent as men over a given time period. So when I talk about this a little bit more, actually, let me go back up. So there isn't very much literature on heat acclimation in women. So we just recently completed a study that I'll tell you about in a few minutes. So we found some really exciting things. But one of the things that came up in the past few years had to do with this idea of short-term heat acclimation. So a lot of people in various settings are interested in, well, what if, because not everyone has 2 weeks, right, to go out and do some kind of training program in the heat. So what if we could acclimatize people more short-term, 3 days, 5 days, what kind of adaptations could we see in that shorter term? So there was a summary that was published by Wickham et al. A few years ago now in terms of whether men, and this was really only based on a few studies. As I said, there weren't as many at that time, but whether men and women can do short-term, or in this case, MTHA stands for moderate, mid-term or moderate term heat acclimation, as much as in the same way as men. And what they found was there's just a different time course. So if we have men here on the top and women here on the bottom, you can see that the men had a faster increase in performance. So they had short-term heat acclimation demonstrated in terms of increase in performance, decrease in core temperature, and decrease in heart rate. But the women had a faster increase in sweating rate. So again, this is based on not that many studies, although they were great studies. I'm not saying anything negative about those studies. And there's different ways you can do heat acclimation. So in terms of working for the US military or doing things that were relatively relevant, to the military, we wanted to do a study to look at physiological mechanisms and adaptations between women and men during a controlled work rate heat acclimation. What that means is you just do the same exact thing every single day. In some of the studies, there's different reasons why you might want to do things differently. So if you're increasing your intensity over the days, some people feel that that's more efficient as a way of acclimatizing to the heat. But so you can see a picture of Dr. Gabe Giersch. She's one of our faculty at USARIUM, and she's amazing. I'm very biased because she's also a friend and my former postdoc as well. But she's the one that led this study, and we just published it, I think last month in the Journal of Applied Physiology. So we're really excited about this, and I'll just talk a little bit about this study. But the idea was, well, what if we just do a controlled work heat acclimation study? What can we find out if we look at men and women? What can we find out about both physiological mechanisms and adaptations that may be similar or different? So this was a protocol timeline. You can see, again, I won't go into the whole thing in detail, but you can see that there were various days of pre-testing, including a VO2 max test and a lot of blood measures. Visits 3 through 12 involved this 10-day heat acclimation protocol. So what they did is they went into one of our climate chambers, and they were working at 5 kilometers per hour, 2% grade for 120 minutes. And that was at 40 degrees C and 40% relative humidity. Now, for anyone who's ever heard of something called the heat tolerance test, this is the actual heat tolerance test that's used by the Israeli Defense Force. So we weren't using it for that purpose, but we were using this for a repeatable exercise intensity. The other thing about this heat acclimation protocol is to make it more accessible for more volunteers. We did allow for 1 day of a break in the middle there, but the first 4 days were always consecutive. And then, as you can see, there were some plasma volume measurements before and after, and then a pre and post VO2 max. So we can look at the subject characteristics. Here, you can see that women were shorter and lighter. Women had a greater body fat percentage, as would be expected. Women had a lower total surface area and a greater surface area to mass ratio. And men had higher VO2 max both pre and post heat acclimation. Also, the other thing I want to point out, because this came up from one of the reviewers in the paper, there was no difference in VO2 max pre and post heat acclimation. So sometimes it happens, and I think it has to do with the pre-heat acclimation fitness state of the volunteers. So sometimes you see that VO2 max increases, but an important thing that we thought was really relevant here is that we saw significant heat acclimation adaptations without a change in VO2 max. So those were two distinct things, which is, I think, important. So this is the most important thing. Well, this is the thing that's most often highlighted in heat acclimation studies is peak core temperature during exercise. How high did core temperature go during those 2 hours of exercise at 104 degrees ambient temperature? And what you can see here is that you have the, oh, sorry, I didn't put the legend on here. So you have the women in red and the men in yellow. And you can see that both women and men had significantly lower peak core temperature starting on day 3 compared to day 1. There were no differences between men and women in the time course of heat acclimation in terms of the time course of how that core temperature was decreasing over time. So if you look at the difference between day 1 and day 10, what you can see is that both men and women had about a ½ degree change from day 1 to day 10, and that delta was not different between the groups. What about sweating rate and dehydration? So you can look here and you can say, okay, we measured whole body sweating rate. This is a very simple and not non-high resolution way of measuring whole body sweating rate, but this is, so it's just pre and post exercise nude body weight. I say just, it's actually really complicated to do it correctly, but we had whole body sweating rate here. And what you can see is that over time, that whole body sweating rate in both men and women increased. Men, you can see the stars there. Men had greater whole body sweating rate on days 3 through 5 of heat acclimation. And I don't know if Stavros is going to disagree with me here on this next part. But if you calculate percent dehydration as a percent of body weight, you can see over time that across the board for all of the days of heat acclimation, men had a higher percent loss of body water or body weight during the exercise bout the whole time. Now, granted, that's about less than 1% on average of dehydration, so it's not something that we would be concerned about in terms of health or performance. But I thought it was really relevant that we're giving them fluid in a controlled fashion. So we're giving them 200 mLs every 20 minutes. So this is how much body weight they lost. And the reason I think it's relevant is that men had significantly, sorry, but I said this already, men had significantly greater total body water loss as a percent of dehydration on all days of heat acclimation compared to women. So the thing I think is interesting about this is increased sweating rate is often presented as a benefit of heat acclimation, which it is, except that care must be taken to minimize dehydration. So if you're in a circumstance where you can't replace your fluid loss, or you don't know what your fluid loss is, so you're not replacing it correctly, this could be a problem. Also, sweat that drips off skin. So if you're doing a marathon in a humid environment and your sweat is not evaporating at all, does not help you with any of your thermoregulation and actually, in fact, just leads to dehydration. So I just thought that was an interesting kind of observation that Gabe had in this study. What about heart rate? So again, we were doing a controlled work rate study. So since the women's VO2 max was lower on average than the men's, women had significantly higher percent of VO2 max. So it's not surprising they had a significantly higher peak heart rate across all acclimation days. But again, in terms of the acclimation effect, in terms of the physiological adaptation over those 10 days, it was very similar. So men had a 14 beat per minute delta from day 1 to day 10, and women had an 18 beat per minute delta from day 1 to day 10. The acclimation effect to decrease heart rate started on day 2 for women and on day 3 for men. So in summary, there were no difference for this study. There were no differences in core temperature during exercise or adaptations in core temperature over the 10 days of our heat acclimation study. Men had higher sweating rates and greater dehydration during exercise, but both men and women showed similar sweating adaptation over the 10 days of the heat acclimation. Women had higher heart rates during exercise, and both sexes showed the decreased heart rate adaptation during acclimation. So our findings suggest that controlled work rate protocols are effective for both sexes, and there's not a need for sex-specific guidelines for practical heat acclimation protocols. So when we think about, so I work with a bunch of biophysicists. I am not a biophysicist, I'm a physiologist by training, but one of the things that we think about sometimes is thermal biophysics and how the body interacts with the environment, or with the clothing plus the environment and things like that. So if we think about body size, we can say that heat is generated during exercise by contracting skeletal muscle and other metabolically active tissue. All of these things are linked to body mass. But we dissipate our heat based on body surface area, assuming all else being equal, assuming the same amount of surface area is if someone's running in, let's say, shorts and a t-shirt. So women tend to be smaller and therefore have higher surface area to mass ratio, just like a mouse compared to a human has much higher surface area to mass ratio. But as you saw, we calculated surface area to mass, and women tend to have a higher BSA to mass ratio. So in many, but not all circumstances, higher surface area to mass can be an advantage for heat dissipation, because if the air, like in here, for example, if air temperature is lower than my skin temperature or my body temperature, then I'm more likely to dissipate more heat compared to a bigger person. Again, if everything else is controlled. So this can get into a complicated discussion, but I'm trying to simplify it a little bit for the purpose of discussion. So the exceptions, there's exceptions, a lot of them, where are environments where sweat can't evaporate or environmental temperature is very high. There's a set of environments that we call uncompensable environments, and those may not be, it may not be as clear that a smaller person would be at an advantage in those. So, but we were interested in looking at body size, so body mass index and surface area to mass ratio. So we did an epidemiological analysis. Gabe and I were fortunate to collaborate with an epidemiologist that was working with us at the time. And we did a retrospective analysis of risk of exertional heat stroke in 4,465 active duty US soldiers. And again, this was retrospective matched case control analysis using a large database of medical and related information. And so when we identified a case of exertional heat stroke, each EHS case was matched with 5 controls based on calendar time, unit ID, and MOS, which is job category, which means that there were 5 controls for each individual who were doing in the same place at the same time, doing the same thing. So if you look at this was published a couple of years ago now. These are just a few of the factors that we looked at. And first of all, we showed that there was no difference in EHS risk between men and women. If you've been looking at this literature, you will notice that there are 1 or 2 older studies that have shown that there's some differences in incidence, but those studies didn't actually calculate risk in the same way that we did. So again, happy to get into it in the Q&A if folks are interested in more detail. But in this study, we specifically evaluated risk using epidemiological approaches. And the other thing that we found that was interesting and surprising was that the age effect was the opposite of what we expected. So if you see the odds ratio, the younger folks had a little bit more, the younger soldiers had a little bit higher risk of heat illness. And what we think is this is not a physiological issue at all, because as we know, thermoregulation tends to decrease, mechanisms tend to decrease or become impaired with aging. What we think is that in general with soldiers, it's the younger groups of soldiers that tend to be more likely to do the high risk events that's like a 12-mile ruck march, or the things that we most often see those EHS events. So it has more to do with the activities that are common in younger soldiers. We also did a follow-up analysis looking at surface area to mass ratio. And we found that lower surface area to mass was associated with higher risk of exertional heat stroke. And this is consistent with primarily compensable environments. So often when people are doing these high risk events that result in EHS, unfortunately, it is hot. I mean, a lot of the training bases for the US military are in the South, so it's usually hot, but often they're running in the morning and they have shorts and a t-shirt on. So often they are likely to be in a situation where they're compensable. We also did some studies looking at exertional heat stroke patients and looking at organ damage biomarkers. And this was a study that was conducted at Fort Benning in Georgia over 3 heat seasons, which is April through October. We identified EHS patients who were brought to the emergency department after they had collapsed in the field. If anyone's ever been to Fort Benning, it's ginormous, and they have training events all over the place. So it might be several miles away from the hospital when someone collapses. So they have a really good EMS system, and we were able to work with, this was in collaboration with Dave DeGroot, who's at the Army Heat Center that's located there. He's the head of that Army Heat Center. So in this study, we were able to identify over 3 years, and again, a reminder, exertional heat stroke is the most serious medically urgent heat illness. So this does not include people who had heat exhaustion or who had more milder forms of heat illness, but we had 11 women and 51 men over this 3-year period. They had similar highest recorded core temperatures. So this is when the EMS arrives on the scene and they take the core temperature. And maybe after some cooling has already occurred. So again, this is a field study. It's not as controlled as if we were in the lab. But interestingly, their highest recorded core temperature was similar between men and women, suggesting that the severity of heat stroke in terms of temperature was similar. However, we were a little surprised and interested to see that the absolute values of several organ damage biomarkers that we measured were, were lower in women compared to men. And this was true even when we corrected for the fact that the reference ranges, so for example, men have more muscle mass, they might have different reference ranges, or they do have different reference ranges for creatine and creatine kinase. So what we did was we did a calculation of the mean difference from the top of each group's reference range, and that's what's shown here. So you can see that women had lower values for creatine kinase, also ALT and AST, representing liver damage biomarkers as well. So our results suggested differences in sequelae from exertional heat stroke between men and women, despite similar peak core temperatures in both groups. Although men and women have different reference ranges for all of these biomarkers, the differences persisted when viewed in the context of those ranges. One possibility that I've thought about, but I don't think anyone's looked at and we haven't looked at, is that there may be differences in blood flow. So I'll talk in a minute. I'm worried I'm talking too much, but I'll talk in a minute about some blood flow, blood pressure regulating things that are different between men and women. So I think that might be contributing to what we're seeing here, but I'm not sure. So further work is definitely needed. Okay, so now to switch gears a little bit, I want to point out, in case no one had already realized this, that the regulation of body temperature and blood pressure are very tightly linked to each other. So if you think of the sympathetic nervous system as being quite ubiquitous, regulating a lot of different things, we think of it a lot as regulating blood pressure or this whole fight or flight idea that you learn in school. But it is actually very integral to regulation of body temperature as well. And in fact, those two things have a Venn diagram as shown here that really overlaps quite a bit because of the blood flow regulating mechanisms of the sympathetic nervous system. So if we think of the actual responses having to do with broadly vasodilation and vasoconstriction, you can see that for blood pressure regulation, that would result in hypotension or hypertension if we just had massive vasodilation or massive vasoconstriction. And for body temperature regulation, that would result in heat dissipation or heat conservation. Certainly, if we go outside and it's cold outside, we constrict all the blood vessels in our skin, and that helps to conserve body heat. So I'll talk a little bit more about the responses of sympathetic vasoconstrictor nerves during heat stress. So let's say you go outside. I think everyone's experienced, you go outside when it's hot out. For some reason, if you have to stand still for a little while, you might start feeling a little dizzy or lightheaded. We see it in the military all the time. Unfortunately, we have these groups of people who have to stand in formation. And then every single summer, there's be like a few people that collapse and go down. Anyway, so this is related to blood pressure regulation during heat stress. So during body heating, skin blood flow, as we talked about, increases and central blood volume decreases. So the amount of blood coming back to the heart decreases because there's more blood flow out in the skin. This results in relative decreases in venous return and stroke volume. which contribute to decreased orthostatic tolerance with and hypotension. So sympathetic vasoconstrictor nerve activity, which we can measure as something called muscle sympathetic nerve activity, or MSNA, increases in response to both heat stress and dehydration as a mechanism to try to maintain blood pressure in the face of this decreased venous return. This is an example of that from more than 20 years ago now. This is from Craig Crandall's lab in Dallas. And what you can see here is adrenergic control of arterial blood pressure. Sorry, it's not an example of what I just said, but adrenergic control of arterial pressure changes during heat stress. And this is part of the reason that sympathetic nerves have to increase their activity. If you give an infusion of phenylephrine, so intravenous phenylephrine, that's an alpha agonist, and it causes vasoconstriction. You can see that under normothermic conditions, blood pressure goes up in a linear fashion with dose of phenylephrine. But when you're heat stressed, it still goes up, but it goes up a lot less. This is showing that those sympathetic nerves are trying to maintain blood pressure, but there's other things going on with these vasodilator mechanisms, so it's less effective. You can also see this if you look at head up tilt, and you can see that there's these people were exposed to heat stress using a waterproof suit and then head up tilted. And the reason I'm smiling is because I've always had the worst tilt tolerance. So if you put me in a suit and put me on a tilt table, I would be collapsing at like minute 1 over there. But these people did it. I wasn't in the study. This was Thad Wilson, actually, when he was working with Craig as a postdoc. And you can see percentage of subjects remaining and then minutes of tilt. And then you can see that as if you do the skin cooling, that helps those people who weren't able to maintain the tilt, that helped everybody to maintain the tilt for the whole period of time. So if they were hot, but then you cooled their skin, well, that would cause a vasoconstrictor response and help maintain that blood pressure. So what about, we go back to this picture of influences of female reproductive hormones, and this influence of estrogen. Well, if we think about the influences of estradiol to promote vasodilation, this might not be a great thing if you're augmenting the influence of body heating to decrease total peripheral resistance. So if what you're trying to do is maintain your blood pressure, this might not be helpful. So if we look under normothermic conditions, this is a study when I was still at Mayo, and Emma Hart is the first author of this. We did intrabrachial infusions of norepinephrine and looked at vasoconstrictor responses in the forearm. And what you can see here is that in the control condition on the left, there were women were shown on the black, and then men are shown in the dashed lines. And women had almost no vasoconstriction in response to intrabrachial norepinephrine. But when we gave beta blockade, they had very similar vasoconstriction compared to men. So what we saw here, this was not having to do with heat stress, but in normothermic conditions, estradiol appears to offset noradrenergic vasoconstriction by augmenting beta adrenergic vasodilation. So if we think about this, go back to this figure here, what if we add heat stress to this whole scenario, right? So if we add heat stress, what happens is everything shifts towards vasodilation, because the thermoregulatory stimulus to dilate blood vessels is going to occur. So if everything else is equal, we're going to increase heat dissipation, but we may also increase our risk for hypotension there on the left. So what does that mean for women or people with estrogen during heat stroke? This is another summary figure, which I will skip over for now. So I could only find one study, this was actually from John Halliwell's lab in 2005, where they were interested in looking at orthostatic tolerance during heat stress in men and women. And in this case, this was Jessica Meandering, and she was interested in seeing if there was an effect of menstrual cycle phase. So she looked at, on the bottom there, you can see early follicular EF, ovulatory, and ML for mid-luteal. So different levels of estrogen and progesterone over the course of the menstrual cycle. And what you can see there is that there was no difference as an effect of menstrual cycle, but in all phases of the menstrual cycle, this heat stress plus orthostatic test was less. So their cumulative stress index, which they did on with lower body negative pressure in the study, was less than men in all instances. So there was this lower orthostatic tolerance in women was not different, but occurred in all 3 cycle phases. This appears to have been due to a cardiac output or stroke volume issue. So it seems like women, the major difference in terms of their hemodynamics appeared to have been a stroke volume, a smaller stroke volume in the women, which is again, not surprising. So this kind of summarizes, I wanted to try to stop, to leave time for questions. But this is again an example where women tend to be smaller, have smaller hearts, so therefore may require higher heart rates and or have lower stroke volumes in different circumstances. And if they're not able to accommodate for that, this may end up with lower orthostatic tolerance. So finally, I wanted to show a summary figure published earlier this year in Physiology. Because I wanted to emphasize one of the things that's exciting about both blood pressure regulation and temperature regulation is that it's inherently an integrative physiology phenomenon. You have to think about all these aspects. I've kind of shown examples of people who have studied molecular, cellular, animal models, humans, and more applied human studies, which I would see as the right hand of this continuum. And really, we have to think about all of it. And I think that's what made me, this type of work, the things that are related to temperature regulation and humans and exercise, this is what got me excited about this field 30 years ago, I hate to say, when I first decided to go to grad school. So, and it's because of this, it's because of this very integrative nature of the whole thing. So finally, just to summarize what I've talked about today, female reproductive hormones have important non-reproductive effects on autonomic regulation of body temperature and blood pressure. Estradiol promotes vasodilation and heat dissipation and can offset the vasoconstrictor effects of noradrenergic stimulation. Young women may sweat less in some circumstances, but overall do not have higher risk of heat illness, exertional heat illness compared to men. And the influences of estradiol to promote vasodilation often result in lower blood pressure and orthostatic tolerance in women, particularly during environmental heat exposure. And again, as I just was saying, it's really important to use integrative physiological approaches to evaluate and quantify sex differences or lack thereof. I want to thank the team. This is part of the team, and this is a picture from a party we had at my house this summer. We have some junior physiologists on the team, as you'll notice there. And thank you very much for your attention. I'm happy to answer any questions. Grab some water.
Great.
Any
questions from the room? I know there is already some questions in Q&A. So from the online viewers, if you have questions, please put them in Q&A and we will address them as they come.
Thank you for your talk. I have two questions about the study that you presented, done or published by Gears. So the first one is, what was the time over 38.5 Celsius for both sexes? Because you showed us that that there's a difference in peak temperature. Well, is there a substantial difference in time that they're above that 38.5 threshold, as that is often referred to in the literature as sort of cutoff that you need to go above to adapt?
So really interesting question. I'm very glad you brought that up. Do I need to repeat the question?
No, I think.
Oh, okay. So I don't know is a short answer. I also don't agree with looking at about temperatures above 38.5. So one thing that we've been really trying to work hard to do is make sure that people understand that heat stroke is not a specific body temperature. There's nothing magic about 38.5. There's some people who look at things above, as you know, above 38.5 as like when you're getting close to having a risk of heat illness or something like that. But there's a lot of literature showing that you can have a heat stroke at lower than 38.5, and then you can be at 41 and not have a heat stroke. So I think people get a little too focused on what the temperature is, and for some reason 38.5 became something that people were interested in. I'm not saying it's not important. We didn't quantify that for this study, but I think it's more important what's happening globally in terms of the integrated response. So if you are a very well-trained runner and you do marathons in the heat all the time, you might do the last half hour of your marathon at 40.5 and you might be perfectly fine. I mean, you won't feel great maybe necessarily, but there's examples in the literature of people who are just fine at higher core temperatures and people who have heat strokes at 38.5 or lower. So I don't know. So the short answer is I don't know. And the longer answer is I don't think we should be that focused on that specific temperature.
Yes. What I want to add to it is I understand your perspective, but if you look at it from an adaptation perspective, and what you see is that they sort of start at the 39 Celsius peak, and then it goes down. And the line on average stays above 38.5, I think. But it also shows a substantial variation between individuals. I was just wondering from an adaptation perspective, because it looks like that they're adapting as they go while they are in the study. So that was the reason why I looked at it that way. The other question that I had is, was the sweat rate efficiency similar between sexes? And what I mean is, was the skin wetness, different between those two sexes? Specifically, if the females potentially could intervene with adding more wetness, maybe with an intervention, adding more wetness to the surface.
I see what you mean, yeah.
Could that result in, closing that gap difference in potential performance?
Again, another great question. I'm not sure that we want to close that gap because as I was saying, I feel like I don't think women need to sweat more in this example. We didn't measure skin wetness, so great question. We didn't measure that. So, but I mean, in terms of our data, I interpret that as, I don't think they needed to sweat more in this example. There was another question back there.
First of all, thank you for taking time off the Phoenix for your personal vacation.
Thank you.
My question is more on the side of the methodological considerations. You mentioned measuring sweat in specific locations. You said chest, for example. Could you provide context for why you measure sweat at the chest versus the arm or the head, or even using new body weight as an indicator of sweat rate?
Great question. So why would we measure sweating? I will defer that to my colleagues who have done a lot more work in that area, such as George Haveneth in the UK. So that wasn't our study when I was talking about chest sweating rate, but there are specific reasons. So that sometimes people have, often you'll see forearm sweating rate, so like a localized sweating rate on the forearm, a localized sweating on the chest versus whole body. There's reasons that people get interested in one or the other. Sometimes if you're interested in something like the threshold for the onset of sweating, you might look at a specific location where you can get continuous sweating measurements using a sweat capsule or something similar. However, that doesn't give you information about whole body heat loss. So the reason we decided to use this whole body heat loss is it has less temporal resolution. So we only have one value, which is before and after. But it gives us more information about basically the total sweating response to that exercise, bout. So there's definitely pluses and minuses to all of those approaches, but we chose just to look at kind of the biggest picture aspect, if that makes sense.
We have a couple questions from
Yeah.
the audience. Holly, you want to?
Sure. Thank you for a very interesting presentation. Please tell us how you use AI in your research today. Also, do you foresee regarding the value of AI in future research studies?
I have not used AI at all, ever. So I don't really have an answer for that question. There was no AI used in the research or in the development of the presentation. So I'm a little scared of AI, frankly, but my husband actually works in that area, so he probably wouldn't like me saying that, but I have not used it for these things.
And it's you real here, not AI.
This is myself. I attest to the fact that I'm physically here. I am not, what are the things called when you make the, I forget what it's called when you make like a fake picture? Yeah.
Not an avatar.
Yeah, it's not an avatar, it's me.
Do we know what specific features distinguish heat stroke victims from those unaffected by the same circumstances?
So great question. I would say that is a big focus of our work. Because as I was just mentioning to the other question, sometimes people can be in very similar circumstances or even have similar or higher core temperatures and not get a heat stroke in the situation where someone else does. There are some specific things that we and others have identified, such as, for example, you're definitely at increased risk of heat stroke if you have recently had a viral illness. So a lot of times with soldiers or others who are very competitive, they will go out, even if they were just really sick recently, they'll still try to go out and do an event. They shouldn't do that. They're told that they shouldn't do that, but they want to kind of push through, and those are the people that are at higher risk for heat illness. Definitely, if you aren't acclimatized, that's a risk for heat illness. If you I thought of one other thing I was gonna say and I just lost it, but so we do know some of the risks, we don't know all of them. So certainly there are some circumstances in which we can't identify why a particular person had a heat illness, but those are some of the things we're trying to figure out.
One more question. Thanks for the presentation. If I understood correctly, you mentioned that a higher sweat rate after acclimatization is not always good. Do you mean that depending on the environmental condition, we should not acclimate? Could you comment on that?
Ah, interesting. I will never say, thank you for the opportunity to clarify. I will never, ever say, do not acclimate. Please always try to acclimate to the heat. I will say you should always hydrate. Maybe that's a good point to end on in this talk. I think it's just really important to pay attention to your hydration. If you have the opportunity to learn about your sweating rate by doing your own pre and post body weight measurements, learn about your own sweat. If you're a heavy sweater or a light sweater, just to learn about what your water needs are, that would be excellent. I would always say to acclimatize because you're going to decrease your cardiovascular strain, you're going to decrease your overall physiological strain, regardless of whether you're a heavy sweater or not. I would say just make sure you stay hydrated.
One question.
Oh, yeah.
Does the military have different recommendations for pre and post-menopausal women, or are there many post-menopausal?
So good question. They don't. You mean in terms of heat stress?
Yeah.
Yeah, they don't. It's something that we're in general, there aren't that many postmenopausal women who would be doing events that would be at high risk for heat stroke. But it's a great question, and often when we've tried to do a little bit of work in that area, often when we try to work in older populations, we're told, no, that's really the purview of the VA, so that should be something they should do. So as of right now, there aren't any specific regulations for that, but that is something we would like to pursue. Just to, make sure, I mean, well, I won't say that. But there are women at higher rank who are probably around that age.
If you're at greater risk or.
Right. Certainly, well, if you're bringing that up for that reason, definitely there's an aging effect. I didn't talk about that at all today. There's definitely an aging effect on thermoregulation, and there are some studies in postmenopausal women which suggest that older women may indeed be at greater risk. Now, that's a different kind of heat stroke, because usually when you see heat stroke in older people, it's passive. Great question. Yes, in the big picture, it does. So we always try to tell people, maintain hydration, do your best to stay hydrated. Now, couple things about that though. If you're dehydrated, you are at increased risk of heat stroke. However, if you're euhydrated, you're not at zero risk of heat stroke. And I think that's where there's been a little bit of a confusion in some of the people that I've talked to. So if you maintain hydration, that doesn't mean you can do whatever you want with the other risk factors, and then you'll be perfectly fine. Recently, actually, Dave DeGroot did an analysis where he was looking at risk factors, and he showed that euhydrated people, almost everyone in the population he was looking at was euhydrated, but there were still these different other factors that were associated with heat stroke. So I would say, yes, absolutely, you should maintain euhydration. And it does decrease risk in that area, but it doesn't decrease like the other risks that are unrelated. So, yeah.
I have a question. I will start with the general, like, will women be in risk of break? I had to say that, right?
Exactly. No, I have this other slide. Well, anyways. Yeah, exactly, Stavros.
I was sick and tired of listening to comments like that,
Yeah.
back from
Right.
years
Back
ago.
when you and I started, right? Yeah.
But the real question is more related on the methodology of how we study, whether it is sex differences on heat tolerance, and also differences in younger adults and older adults and kids, especially in the kids literature. And I think a lot of that conversation might have started by how we try to use exercise, how we try to normalize exercise intensity between groups. So using the percentage of VO2 max as the ultimate equalizer of intensity versus more modern techniques like metabolic heat production per square area of body surface area. Can you make a comment on this a little bit? People keep finding these papers and they say this paper so that women are, substantially less tolerant. Children are in a major problem in the heat
Which
and on and on.
they're not actually either. I think there's some newer stuff coming out, if I understand recently, that children, I've always thought children were at increased risk. Turns out they're probably not either. So I think it depends. So interestingly, this is reminding me of my PhD advisor, John Johnson. I used to go in and talk to him with questions. I was all excited about different things. And he used to kind of like rein me in a little bit and be like, Nisha, what is the question? Like, what is your research question? And I think that's when you're talking about what's the best way to do something, I think in my mind, it comes back to that. So if you're trying to say, okay, if the body produces this much heat, then what is and this is the E required, let's say, then what is the response to that? In terms of, let's say, that older study from Glenn Kenny's lab, then that's a research question. You can say, okay, at this super high intensity, there was this much heat produced, and there was this much sweating in men and this much sweating in women. Okay, that's a question and an answer. But if you have the question of when men and women are out there doing stuff in the world, and they're doing stuff that's similar, because if you're in an occupational setting and you have to do a task, that's not going to be a task that's in watts per kilogram or watts per body surface area. It's just a task. And so if you're out there doing, and I'm not saying the other thing isn't valuable, it's really valuable. But if you are trying to say, like, are women at increased risk, then have them do stuff that's the same or similar, at least, like we did in our studies, and then in the studies that I presented from these other labs. When they do stuff that's the same, they kind of take the same risk management. I think, it seems like the core temperatures are similar, the adaptations are similar. Maybe women sweat less sometimes. By the way, not always. And there's a lot of individual variability. So we published a paper a few years ago now about this question, and it just has to do with some of my Israeli colleagues, actually. And it just has to do with looking at a situation where men and women have to do something, taking similar risk mitigation approaches for both men and women, and then seeing what happens. And when you do that, it seems like the actual, risk is similar, as I've been saying. But is there an ideal way to study that? No, I don't think so. Because I think it depends, like, if your question has to do with like the biophysics of heat transfer and then the actual like heat stimulus relating in sweat secretion, then that is one question that's super, super valid. But if your question is risk of heat illness, then don't take that other study and start calling it risk of heat illness, because it's not. Does that make sense?
Yep. Thank you.
You mentioned the CEUs.
Oh, can you mention the CEUs, she said?
Yeah, so we put in the chat the links for the CEUs if you're interested in getting a CEU, so please follow those links. If you have any questions, connect with us, and we will continue next year. We will have the Water Talks 2026. Thank you again. Thank you. Appreciate it.